critical and really doesn't get all the attention that it should. Community health centers, the reason we're celebrating this week is that they have made an unbelievable impact. As Maggie mentioned, by 2013, 21 million people will be getting their health care services through community health centers. On that, in Massachusetts, over 760,000 families already do. And that's an important aspect on that. Affordable, preventable usually ahead of time on that, accessible. You know, these are all important things for people that just sometimes don't have any place else to turn. And the work that you've done in making yourselves available to people and reaching out is just fantastic. I hope that as we acknowledge this week, one of the things that comes of it is other people become aware of the availability of this center, because it is a good way for this country to provide health care. One of the ways that we can all come together, Vito's party, our party, the senator, all of that, we all understand the importance of this, and we just have to make sure that we do that. I was honored when Maggie and other representatives of the Mass League came down earlier this year and were kind enough to give me the award for 2012 for fighting for health centers, but there's a reason we fight, and it is because of the great work that they do. In the Recovery Act, we had $2 billion for community health centers, be able to renovate and expand on their services. We had a good amount of money come here for expansion of dental care, which is important on the North Shore. I think too often people don't understand the impact of bad hygiene in the dental care with your overall health until they get a toothache. And I'm always amazed. I've been in school after school where I see students have an opportunity for the first time in their life, sometimes 7th and 8th graders, first time going to a dentist. And you find out that they have been living with some problem that the rest of us be taking days off and packing ice on the side of our head just to try to get through the day. So as we meld things like that into our portfolio of things that we present for people and provide for them, it's more and more important. The Affordable Care Act put $11 billion into community health centers on that, and we'll be able to construct some new centers around the country on that, but also to enhance and improve the ones that we have. We've got some risk at chance. There's obviously competing ideas of how we're going to go forward. One budget idea would cut Medicaid by 20%. And that, of course, would put great risk programs and threat to programs like this. Fortunately for us, the President sees it differently, and hopefully we're going to be both sides get behind the notion of supporting health centers and moving forward. This week should just be all about congratulating those of you on the board, on the staff, and that those that take advantage of this as an affordable way to get health care that is tops and comprehensive. I congratulate you on all the work that you've done. Thank you for letting me be part of your celebration.